what are the top tips for having your pet, like you say, your senior pet with you for the greatest number of years?
Having a vet visit at least once a year is, I feel like, a very crucial component to this, because when we get to senior pets, getting into that like 5 to 7 to 8 year range, having some yearly blood work done to just make sure, there's nothing abnormal going on.
Welcome back to the Pause and Effect podcast, where we bring you credible expert advice to help you take the best possible care of your pets. I'm your host, Dr Carra, a veterinarian with a passion for sharing accurate information to empower pet owners like you. Today, I'm excited to be joined by a special guest, Dr. Amanda, also known as the Senior Pet Vet. Dr. Amanda is a seasoned veterinarian from Ohio who specialises in the care of senior pets. She uniquely blends traditional Western medicine with alternative therapies, including acupuncture, to provide comprehensive care for our aging companions. In this episode, we'll be diving into the world of senior pets, discussing how different breeds age, the common diseases that geriatric pets often face, and most importantly, how we can mitigate some of these risks through proper nutrition and preventative healthcare. Whether you're caring for a senior pet now or want to be prepared for the future, this episode is packed with valuable insights. So let's get started and learn how we can give our senior pets the golden years that they deserve. A very, very warm welcome to Dr. Amanda to the Pause and Effect podcast, all the way from Ohio. Is that correct?
Yeah, Ohio. So thanks so much for having me.
Oh, it's wonderful. And thank you very much for finding the time. I know you're a very, very busy mom and veterinarian, so I appreciate you taking the time out of your day.
Yeah, it's juggling everything, but I still love the idea of coming on and chatting with you guys and getting some more information out about senior pets. And just getting to collaborate is wonderful. So,
no, thank you. So I think I want to start out by introducing the fact that you do something a little bit different. And I think that's what piqued my interest initially, was that you combine both, and you're very pro-Western medicine and Western veterinary care with some alternative therapies. And so can I ask you to introduce what you do and perhaps why, where that started and why that interests you?
Right. So I mix between Western medicine, which is, our general everyday medicine, vaccines and, diagnostics and things like that. And then also mix in acupuncture and a little bit of food therapy and herbal therapy medicine. I'm only at this point officially licensed in acupuncture, but I can still dabble in herbal therapy and things like that. It really started as a way to help senior pets a little bit more. I felt like with older animals, we kind of hit a wall with Western medicine. There are a lot of wonderful things we can do for them with medications, and more things are coming out every day. But I also felt like there were patients that I would see that couldn't take the typical medications for one reason or another, or were tapped out on all of those medications. And I just wanted something else to help them. Like, I wanted to be able to make them comfortable in another way. So I went and became licensed in acupuncture. I have seen such amazing results with acupuncture. It's amazing to me. Even I go and I do it, and I'm still just like in awe of the response that I get from patients when I go. And then, being able to integrate that with Western medicine, I can talk to people about, laser therapy, electrical stimulation, different types of things. I also work closely with a rehabilitation technician here at one of the local hospitals. So, the clients that can do all of those things and we integrate everything together, I truly feel like we're seeing the best response with them. In other areas of the world, integrative medicine, meaning we're mixing Western and, traditional medicine, is the mainstay. Like, that's what they do. So I just think that that's really where we're going to find cures and fix things and really help quality of life when we can just seamlessly kind of flow between the two and not have any sort of hostility towards one or the other for any reason. So it's really been eye-opening to me, and I am I will never go back, and I will definitely continue to advocate for like the integrative approach, because I think it's, it's what's best for our pets. So.
That's great. And so let's provide some clarity. So you made mention, you feel very strongly about things like vaccines and good nutrition and preventative healthcare, as most
Right.
pet owners would know it. Can I start by asking? We obviously, I know you as a senior pet vet. Why the interest in the senior pets? What is it that made you get this calling?
Yeah. I don't know if there was like a moment in time, but I had my heart dog was a mix that I got from a dog fighting situation. Just the nicest dog ever, was so kind to everyone. I got him when he was younger, but he was always kind of an old soul dog. He was always just a very like calm, happy dog, and just being able to take care of him into his senior years really kind of showed me all of the different facets of that and them aging. And it was beautiful to me to see, kind of him gracefully age. And just, I kind of from there started to choose all of the animals that came through our door in Western medicine. I would try and gravitate towards the senior pets. Puppies are so much fun. Kittens are so much fun. But I really just like the older, calm, just kind of want to be loved, want a soft place to land. It just really, I guess, vibes with my soul pretty well. So I always felt like I was kind of an old soul. So, these guys that just kind of really want love and comfort in their senior years really spoke to me. And I just have always really enjoyed trying to find ways to keep them comfortable. And really, I feel like they need an advocate. So many times I talk to clients and they say, oh, well, they're a little stiff, but they're just getting older, or they're slow, so they're just getting older. And I'll say, no, we don't need that. We can do things about that. We can help. There are supplements, there are meds, there are alternative therapies, there are ways that we can help these guys. And when clients know that, and then when they see the results, it's amazing to have them say, oh my gosh, he's 5 years younger again, or we haven't seen him do this in years. So it's super rewarding to know that those pets, even though they can't tell us they're in pain, we can kind of pick up on it, and then we can help them, and then we can bring them back to, a good plane of comfort. So I think the challenge of that and the reward of that also are something I just really enjoy getting.
That's wonderful. I can see why. So I think historically, and probably this is showing my age a little bit, when I first started out, we would always be classifying our senior pets as over 7 years old. I don't know whether you were ever exposed to that. For our listeners, Can you help define senior pets, and at what stage, breed dependent or cat or dog dependent, you classify them to be seniors?
Yeah, and there is a little bit, obviously it's still a little fluid with that, because certain breeds will be considered senior a little bit earlier than others. But in general, when we're talking about small dogs and cats, so cats and dogs, up to 15, 20 pounds, those guys are in general going to live a little longer. So they usually are not considered a senior until they're 10 to 12 years old. So, we get a little longer with those because we do see small dogs and cats that live into their late teens, 20s. And then when we're looking more at our middle-sized dogs, 20 to 50 pounds, those guys are considered seniors, usually around 8 to 10 years of age. And then as we get into the bigger dogs, 50 to 90 pounds, we're probably looking at those guys being seniors around 7 or 8 years old. And then our giant breed dogs, so 90 plus pounds. There are certain breeds of that I will tell owners we're considered a senior at 6, anywhere from 5 to 7, depending on the breed and how big the dog. Unfortunately, our, dogs that are going to be 150, 200 pounds, those guys can even be considered senior, meaning they have arthritic signs. We're going to have some, potential for cancers and things like that, even as early as like 4 years old. So yeah, it definitely is size dependent, and there's a little bit of a way to kind of box your pet in, but it's definitely good to look into the breed and how long they live.
Absolutely. And so obviously we are seeing some of our pets as puppies and kittens, like you made mention of before. What is your advice when you see them to try and prepare owners for keeping them in their lives and in their homes for as long as possible? So what are the top tips for having your pet, like you say, your senior pet with you for the greatest number of years?
Yeah. I don't say this just because I am a vet, but I say this because I have seen the effects of it. Having a vet visit at least once a year is, I feel like, a very crucial component to this, because when we get to senior pets, I diagnose heart murmurs in older dogs and cats all the time. So if we're having, a dog with a heart murmur, and we can have them go see a cardiologist and actually get a workup and get on the right medications at the age of 8 or 9, then we're probably going to get a longer lifetime with that pet than if we're seeing them with that disease at, 12 or 13 and they're in heart failure. So definitely, even from being young puppies and kittens, having that yearly vet visit to just see how they're doing, and check up and catch anything small, little lumps and bumps, heart murmurs, things like that would be definitely a really good thing to do. As they get a little older, I do advocate a lot for routine screening testing. So when we're getting into that like 5 to 7 to 8 year range, having some yearly blood work done to just make sure, there's nothing abnormal going on. We're not starting to see some early kidney changes, or maybe they have an underlying tick-borne disease we didn't know about. So if we're checking for that, at least we know, that could be dormant, and we know we need to look for that in the future. And then, also we can do some routine x-rays, so screening x-rays to look for, anything abnormal in the abdomen, changes to the liver, mild changes, or like maybe there's a splenic mass we didn't know about, because that will show no clinical signs. So being able to screen for things like that before they become a major problem, I think is great to do. And you can also, use your vet as a really good resource of, what foods we're feeding, what vaccines we're giving, those types of things, because they're animals that come in with, we get cats that get feline leukemia from being out and running around. And if they had, gone to a vet appropriately and had the feline leukemia vaccine, their risk of getting that disease would have been much smaller. Dogs routinely going in, especially in my area, ticks are a huge thing. So having them come in and have tick screening tests, but also be on prevention for ticks and things like that, are really going to help protect the organs and protect their body and prevent them from getting those problems. So I think preventative care is a huge thing, and we definitely need to advocate for that in our animals, trying to prevent things from, happening before they occur, as opposed to we're already behind the 8 ball and there's an illness and we have to try and fight it at that time.
Hello, I'm Dr. Carra, a veterinarian and the host of the Pause and Effect podcast. Our show is all about enhancing the lives of pets by providing reliable, science-based advice and engaging in discussions with experts in veterinary medicine, pet nutrition, and animal behavior. As a professional with years of experience in both the UK and South Africa, I run a 24-hour veterinary hospital and an online pet store. I'm also pursuing a master's in animal nutrition and consult for UltraPet, a local veterinary-grade pet food manufacturer. My passion lies in sharing knowledge and helping pet owners make informed decisions about their pet companions. The Pause and Effect podcast is rapidly growing, attracting a dedicated and engaging audience of pet owners who are passionate about their pets' health and well-being. Our listeners trust us for credible, informative content that empowers them to provide the best care for their animals. We are looking for sponsors who share our commitment to pet health and who want to reach a highly engaged and expanding audience. Partnering with us means aligning your brand with trusted and influential content that resonates deeply with pet owners. As a sponsor, you'll benefit from high visibility on a platform that is used for multiple purposes, including educational content, product recommendations, and community building. We offer various sponsorship packages designed to fit your marketing goals and budget, ensuring that your brand gets the reach and the impact it deserves. Join us in making a difference in the lives of pets and their families. Let's work together to bring valuable insights and quality products to our passionate audience. If you're interested in sponsoring the Pause and Effect podcast, please get in touch. I look forward to partnering with you. Before we resume our conversation, let's address a vital aspect to pet care, your puppy's nutrition. Allow me to introduce you to a personal favorite, Ultra Pet's premium recipe for large breed puppies. I've relied on this for all my dogs, and it's truly made a difference. This puppy food offers a balanced blend of nutrients, with 30% protein, 15% fat, and 4% fiber, supporting your companion's growth and development. Featuring a delectable chicken and rice flavor, Ultra Pet caters for even the pickiest eaters. It's available in 2 pack sizes, a 8 kg and a 20 kg, and it's suitable for households of any size. What sets this puppy food apart is its meticulous formulation, developed by experts for a complete and balanced diet. It includes essential vitamins and minerals and prebiotics for a healthy digestive system and a robust immune system. With high-quality protein sources and essential fatty acids, this food promotes muscle development, healthy skin and coat. Plus calcium and phosphorus strengthen bones and teeth. Ultra Pet has mastered the balance between nutrition and taste, making it a top choice for puppy food. Find it at your local pet store and give it to your companion for the best start. Your pet will thank you, and you'll appreciate Ultra Pet's commitment to optimal nutrition. Now, let's get back to our conversation. And how important would you say things like diets and regular vaccinations and, like you say, you're doing preventative care, but when you're advising owners, do you see the benefit of diets in your senior pets? Obviously, you can advise if you're seeing a senior pet as to what they should be fed now, but have you noticed that in your patients that have been on good quality diets that they are doing better? Do diets really play a role in longevity?
Yeah, I definitely think that, the food that we put into our body is going to be a huge player in this for our pets. So when we had a big, kind of uproar about 10, 15 years ago of these boutique grain-free diet things, I also work at a specialty hospital, and they have cardiology, and we would see a lot of heart disease in, 4 or 5-year-old otherwise healthy animals that should not be getting heart disease. And it was correlated to them being on a specific type of grain-free diet from companies who didn't have a nutritionist or someone who has a PhD in animal nutrition on board. They didn't test their foods. They didn't really do anything besides put together a diet, market it really well to the public, that it didn't have any fillers or bad things in it, and then sell it to people. So I saw heart disease from that. I don't have specific data on the other components of things, but I also personally did see a lot of these grain-free or really high protein, trending towards the trying to our pet's a wolf and go back to those types of things. Those marketing schemes, those companies, I would see a lot more overweight pets with those foods because the protein eventually just turns into fat if your dog's not running 15 miles a day like an actual wolf would. And then I also saw a lot of kidney disease because the protein has to filter through the kidneys. So it's putting a lot more work on those guys. So I would see earlier kidney dysfunction in these animals. We also saw a lot of bladder stones and kidney stones in these patients too. And I suspect that also is correlated to the very dense food components of things, and a lot of gastrointestinal upset. So vomiting, diarrhea. I would have dogs and cats that intermittently would just have these episodes of bloody diarrhea, and we couldn't really figure out a cause. They hadn't been given something new or anything like that. And it was related to, or the best thing we could come up with is it's related to this very fatty, protein high, boutique diet. So I definitely feel like those have played a factor in a lot of components of disease that I've seen clinically. So I think it's extremely important to make sure that our food is appropriate for our pets. It's a hot topic in veterinary medicine and with pet owners. So I always try to, instead of recommending specific brands, I always try to say, hey, look for these guidelines. The World Small Animal Veterinary Association has these specific guidelines that say these are the 5 to 10 questions to call and ask the company that you want to use. If you want to use this specific brand, great. Call and ask them these questions. Do they have a boarded nutritionist? Do they third-party test? All these types of things. And if they will willingly and happily answer those questions for you, then, it's probably a decent company. If they kind of ghost you, or if they give you roundabout answers that don't really answer the question, which I've had, then maybe you need to question that company. And I don't think that any of these companies are doing things with malicious intent, but I do think that they may not understand the repercussions of everything because they're not in the clinical world like we are and actually see the side effects. So, yeah.
And with your experience of like offering diet advice and alternative therapies, what's your feeling on the raw food diets?
Yeah. So at this point, there's no data, no research to support raw diets. So, medicine is always changing. I'm not saying that forever and ever it's not going to be an answer. But as of right now, there have been studies, and all of them come up with the fact that our dogs and cats just wind up getting Salmonella, E. coli, Clostridium, all these bad bacteria that build up in their body. And some of our animals can deal with those bacteria and do okay. But the caveat that we deal with a lot of times in clinical medicine is I have had a lot of clients who are sick and unexplainably sick. And that's because they are handling the raw food. And even if they're handling the raw food appropriately, then their dog comes and licks them in the face, or, licks a plate and then they're, doing stuff with it, or, there's transmit over of those bacteria, and we may not know it and we may do all the right practices, but it still may be able to transfer over to us. I know personally I have kids, and I just could never imagine feeding my kids or feeding my dogs a raw diet and then, I know my dog goes and licks my kid in the face. And that can make my child hospitalized sick. Like, they could get severely ill from that. So I just can't support something that I know at this stage has no studies to support it being helpful in any way to our pets, and many studies and large groups that say it's not safe and it's not effective. I just can't get behind that at this point.
Absolutely, I agree. So some of the questions I get asked, particularly in consults with senior pets, is, do I really need this vaccine? I mean, they've been vaccinated several times through their lives. How important is this vaccine that you're making the recommendation of? What is your answer to that? How do you approach that conversation?
Yeah. Especially when I'm talking about older pets, usually those first couple years, they probably need those vaccines yearly. Or, some of our vaccines are every 3 years now, which is great. We do that every 3 years. I still think they need a yearly checkup, but, we can space out those vaccines based on what what the studies have shown, what companies have been able to determine it works effectively. I do think with our older pets, a conversation that I have a decent amount of the time is, I understand if you don't want to vaccinate your, 10, 12-year-old dog that doesn't go outside or only goes outside to pee. I get that. But then we need to do a titer check. So I don't know if that's available where you are, but where I am, we have the ability to send out a blood test that checks to see the levels of their ability to fight off a disease if they were to get it, based on historic vaccines. So there is some information in the senior geriatric research that says some of these vaccines may last, 3 to 5 years. But we do need to be doing titer checks to check the levels of that in their blood to make sure that they are, supported and they're not potentially going to get that disease. And that's a huge deal because I have treated 12-year-old dogs and 10-year-old dogs with parvo, and they don't deal with it well. Their body can't handle fighting off an infection that depletes their entire system. So, a puppy at least has a little bit of bounce back and resilience, but these older guys, it's so hard on their organs. So I think it's extremely important to make sure that they are up to date or at least being checked with titers to make sure we're not potentially getting those types of things. Because what happens when your dog is 10, you want to get a puppy because you don't want the house to be empty when your senior kind of ages up, or you want to try and help your senior dog act like a puppy again. You get this little puppy, and if your older dog isn't appropriately vaccinated, you're exposing them to all of these diseases and potential things. And the last thing that we want is for us to bring a puppy in the house and it to give our senior a disease that could potentially debilitate or kill it. It's not a story we want to tell. And it is a story that I've seen play out. So, it's the hard truth of it, but I think it's very important to make sure that our pets have immunity to what they need, appropriately one way or another, whether that's vaccines or whether that's titer checks.
So what are some of the things that you can pick up when they come for their yearly consultation with you? So some of the diseases perhaps that the senior pets are prone to or that may be subclinical to their owners, but that we can pick up during a consult.
Yeah, I think a huge one is heart disease, because dogs and cats, for a period of time, unless there is substantial damage to the heart muscle, they may not show clinical signs of a heart murmur or heart disease. So when they come in, I frequently pick up heart murmurs, which is an irregularity in the way the heart beats, on exam. Then I'll talk to the owners and say, hey, have you seen any coughing or exercise intolerance or lethargy or, things like that. And the signs, we're talking to someone who has an older pet. So are they exercise intolerant? Yeah, they're 10 years old now. So, they're not running marathons most of the time anymore. So it's hard to pick up on those very subtle signs. So things like that are important, I think, for us to pick up on our yearly exams, because then I can talk to them about taking some x-rays or running a blood test to check for effects of the heart muscle, or seeing a cardiologist, which is ideal to evaluate where that murmur is coming from and if there are medications that can hopefully help prevent them from going into heart failure. So we definitely want to check up on those things. Kidney disease is another huge one that I see in dogs and cats as they get older. So that can, hey, my old dog maybe throws up once a month. It's, we don't think about it too much. Or, they're drinking a little bit more water, peeing, having accidents in the house, but I just assume that's because they're older. In reality, their kidneys are not functioning the way they need to anymore. And there's not specifically a a treatment for that. But there are things we can do to support, again, and delay progression and try and help them the best as we can. So, there are diet changes. There are other things we can do to support their body and keep them comfortable. So I feel like kidney disease is a huge one in dogs and cats, especially cats. Really, any teenage cat, we suspect there's going to be some dysfunction to the kidneys. So getting on that early is ideal. I would say in arthritis is the other main one that I see. So, when I go into rooms and I talk to owners, I always say, hey, are we noticing some difficulty getting up the stairs or on and off the furniture? Or are we not, cats, are they not jumping up on the counter when they used to? Or, these very subtle changes. And a lot of times clients will go, oh, yeah, I guess I didn't really think about it. But maybe they seem a little stiff in the morning when they get up off their dog bed, or they're not really jumping up on the counter anymore. And they used to do that a lot. And I say, oh yeah, that's probably some arthritis. That's something we can help with. They are probably subtly painful, and they're just not able to communicate that to us the most effectively. So we can take some x-rays, look for arthritis. We can also start on supplementation to help support their body and those joints and prevent further breakdown of the joints from arthritis pain. So I think those are definitely some of the big ones that we see. Dental disease is another one. Severe dental disease can lead to defects with the liver and the heart and the GI tract and, oral pain and deterring them from wanting to eat and things like that. So picking up on dental disease that warrants treatment is also super important.
Absolutely. So let's talk the big C, the big cancer, the topic that owners are often very fearful to even come and see us about. Either we've got someone who's very proactive and oh, my dog's got a lump and it's tiny. It's probably nothing. Yeah. Let's monitor it. Or people go, it's been here, it's getting bigger, and I can't. I've been delaying coming because I just think it's terrible. Can you discuss your approaches to how we as vets tackle these lumps and bumps, particularly in our senior patients?
Yeah, so I will say with lumps and bumps and things like that, I definitely always do a thorough check to try and feel for those, but I also ask owners what have you felt? Where are these things? How long have they been there? Are they growing rapidly? Do they feel like they're attached to the underlying skin? Do they ulcerate and open up at any point? Are we having any other clinical signs, in these pets? And those help give us a general idea of, could these be more cancerous, malignant, bad tumors, or could they be more benign tumors? If it's been there for 6 years and hasn't done anything or changed, then it's probably fine. But, if it starts to change rapidly or ulcerate and open up and things, then there's potential that the cells in there have started to replicate in a way that's causing malignant cancer cells. So I always like to approach these situations, as well as most situations, especially with senior pets, in a least invasive to most invasive type of process. So depending on what the lump or bump looks like, ideal first step would be to do what we call an FNA, which is a fine needle aspirate of the spot. And we basically just take a hypodermic needle and we poke it into that spot, and we get the cells inside of the needle and put it on a slide and either send it out to be evaluated by a pathologist, or we can evaluate it in the hospital depending on what we think it is. And we can, try and see, do the cells that are on that slide look scary and cancerous and, different populations and things, or are the cells on that slide just fat globules or just maybe cyst material or bacteria? So that's kind of step one. And, these guys don't need sedation or anything usually for that. So it's an easy thing. And then, the next step, if that doesn't give us an answer, or if we're more concerned about it, would be a biopsy. So then we're taking something kind of like a hypodermic needle, but a bigger area, and we're taking a big chunk of the tissue, and then we're sending that out to be evaluated. And that's usually step two, and we're seeing, if we didn't get an answer on our fine needle aspirate, can we get an answer with this pathology, this histopathology biopsy? And then at that point, we can kind of get a plan together. So if we know this is a particular type of tumor that tends to be invasive and have little tendrils that go out to different areas of the body, or it goes very deep under the skin layer, we can plan a little bit better for removing that mass. There are also drugs at this point that sometimes for particular types of tumors, there are things that we can inject into these tumors as opposed to going in surgically and removing them that can help disintegrate the cancer cells. So it's really nice to know what we're dealing with, to know there are many different treatment options. Sometimes we do chemos or radiations instead of removal first to try and slow everything down or make it smaller so that we can go in and take it off most effectively. So then, after a biopsy component, we are kind of getting a plan from there, and that can go a lot of different directions. It can be surgical involvement to sedate them, put them under anesthesia, and cut that guy off, and send it out and, determine what we need to do from there. It can be sending them to an oncologist if that's feasible for them to get it staged a little better and determine if there are alternative options, like an injection into the cell or, a chemotherapeutic or radiation medication that could decrease the size and make it a little easier, or give them more time depending on what's going on. So I think we try to go least invasive to most invasive in that process, and I never want owners to be scared, but I do want to try and treat it as early as possible because there are certain types of tumors that it gets on the skin, we take it off, we're done. And if we leave it on there too long, then it spreads to other parts of the body or it gets bigger, and then we have a much bigger issue. So I'd much rather you come in, have that scary conversation in the beginning, and we can fix it, as opposed to coming in and having that conversation when it's large and has metastasized into other organs of the body, and we have to have an end of life or euthanasia conversation.
Absolutely. No, it's great advice. So now let's assume that it is going to be a mass we're going to remove, because I suppose that's a planned surgery. Let's talk about the anesthetic risk in senior patients. Are we saying that it's the same as our adults or our puppies and kittens, or do you do things or take measures to try and manage your senior patients under anesthetic that are different?
Yeah, so anytime I am putting a senior pet under anesthesia, obviously, where I work, there's a big mixture of clients who can kind of fund anything we want to talk about, or versus clients who, can kind of fund a little bit less of those things, and we just need to figure out what's most important. But if we're talking about being able to do anything, ideally we're doing chest x-rays or radiographs of the chest on any of these considered senior patients. And that's because we're checking, especially if we have a lump or bump, we're checking for could there be any masses in the chest cavity. Also looking at the size of the heart. Is there any potential that these guys have heart disease that we actually can't hear on our exam? So we're evaluating for all of those things. The heart and lungs are going to be obviously super important for filtering out everything when we're doing anesthesia, because a lot of times these guys are going on gas anesthesia. So we have to make sure their lungs are able to pump appropriately. Everything is going well. So I think that's a huge thing to check first. Really, in most of our pets, we're going to recommend blood work to check organ function. We want to make sure the liver and the kidneys can filter out those toxins really well, and everything is functioning to the best that it can. And that's the most of what the workup, I would say, I usually do pre-anesthetically for these guys. And it's still not foolproof. Those things can be normal and we can have complications, but that can also happen in a 6-month-old, 1-year-old animal as well. I do think that our senior pets, obviously, their body recovers a little bit slower. Their organs are going to take a little bit longer to filter through everything and recover. But that's not to say that we shouldn't sedate senior pets. I've had many clients tell me, their dog has severe dental disease, but we were told by our vet that they're too old for anesthesia. And that's just not the answer, right?
No.
So they're never too old for anesthesia. I've done a dental cleaning on a 22-year-old miniature pinscher, and he did great. So
And probably a lot better after.
he felt great. So it's just a matter of making sure that we're doing the best work we can beforehand and using, heart safe drugs and medications that are going to be a little bit easier for their senior body to break down. We tend to go a little lighter on our protocols with sedation drugs and things like that because they don't need to be sedated as effectively. They're not a young puppy bouncing off the walls. They don't need heavy sedation. They usually just need something that kind of helps, put them into a nice plane of comfort and anesthesia. And then a lot of times we're using gas anesthetics where I am because those are a lot safer and it's easier to reverse. You just kind of cut the gas off and then it usually filters out of their body fairly quickly. But reversible anesthetics are also a great idea. So if it's something that we can use an opioid or something that has a reversal option, that's great to do because if something does happen, their blood pressure starts to have an issue, their heart rate starts to have an issue, we can quickly give them a reversal agent and hopefully, get them back to a plane that we want. So, I think that IV catheters are always a must in my senior pets. Fluid therapy. I do love to keep these guys at least throughout the day in the hospital, with close monitoring. So, yeah.
That's great. And in terms of, I've heard you talk about dementia and behavioral changes. So can we, just for the benefit of the listeners, talk about normal aging changes, abnormal aging changes, ones that need intervention? Can you take us through your advice on behavioral changes in our senior pets, please?
Yeah. Cognitive dysfunction syndrome is really difficult for anyone to pick up on. I will say from a personal experience, I had a dog with it and I had two actually. And it is very difficult to know like what could be a normal aging sign. We expect as our pets get older that they do slow down a little bit. They're not going to want to go on quite as long of walks. They're not going to be quite as bouncy. Those things are normal. Sometimes they kind of just want to hang out on the couch all day. That's okay. But we still have to be very cognizant of them in very subtle ways. And I will have some clients that just tell me something is wrong. Like I know my dog and something is wrong. And I will say that's how I found the brain tumor in my senior dog. He put his mouth on me like he was going to bite me. And that dog would have not bitten anyone in his entire existence. So I knew at that moment, I said, I don't know where it is, but something is wrong. So I never take clients lightly when they tell me that. They know something is going on. I say 100% we're going to go till we find it. We will do everything to find what's going on. But we're looking for minor behavioral changes that give us some indication of, maybe this is dementia or cognitive decline. And we're looking for things like, are they pacing more? Are they panting more? Are they wandering the house at night? So night waking, those types of things are abnormal. Are they having accidents in the home, urinating, defecating, which could be a medical reason, or it could just be that they kind of forget where they are and then they go in the house instead. I had one dog who would just every hour she would get up and pace the house and stare into each room. So like stare off into space for a period of time. And, that's not truly a seizure, but their brain is not responding the way it needs to. Their neurons aren't clicking the way they need to be. So we also have some appetite changes in these older pets. I've had so many people tell me, oh, they're a little picky with their food now, or sometimes they're like skipping meals. And that very much could be a cognitive decline issue. So these guys just, they forget that they didn't eat that day, or, something along those lines. So it's extremely important. They can be circling or doing things like that. Sometimes there's new research going on now looking at muscle tremors. with patients with cognitive decline. So we do know that Parkinson's or Parkinsonism is a component of humans that have dementia or Alzheimer's, and they can get kind of some muscle shakes. And in our senior pets, we are now kind of putting a correlation between especially like hind end muscle tremors and some cognitive decline or dementia signs. So we're learning a lot more and trying to, gather all the information that we can. And we are definitely finding that a lot of these things are early signs of dementia, and we just couldn't really differentiate them.
At least we're becoming more and more informed as time goes on. I think accumulating more knowledge and more information as research becomes available is definitely assisting us in many aspects of how we manage our patients. Dr. Amanda, my final discussion or point is the sad one, and what I want to understand from you as an experienced senior pet vet is, how do owners know when to say it's enough? Their pet has got to a point where it's time to say goodbye. Do you ever find that this is a financial consideration? Do you find that it's due to sort of pain and discomfort, or do they become inconvenient? Or how do owners best make that decision with your guidance?
Yeah. Oh, I will say it's not one size fits all, for sure. So I will have some clients who come in and they just know. And I never tell that to everyone, because it's really frustrating for some people when you say, oh, you'll just know, because some people don't. It's so subtle, or they just have a hard time with that decision, or their pet's still doing things that make them think they still, have some life left, that they aren't ready or don't know if they will be ready. So it's always patient dependent and case dependent. Some people do just know. Some people need some help, and that can come in the form of, looking at what we're dealing with. Are we dealing with arthritis? There are arthritis scales, pain scales that come in a handout form that we can show to owners and have them give a grade to all of these things, and they can grade those things and they can get a number, and then they, the next week can do it again, and they can see, is the number getting worse? Is it really bad in the first place? That can definitely help. They also make those scales for dementia. So you can, get a number, and that gives you a more finite idea. And then again, a week later, do it again. A week later, do it again. Do it once a week with the whole family if that needs to happen. So you have an actual definitive answer of what's going on. And I think that concreteness of it helps people a lot, because we do see them every day, and it's hard to know from someone who is with this animal every day to see those very subtle changes. I do feel like sometimes it does help to have family come over who haven't been over for a few months, and they'll see the drastic change, and they'll say, oh, obviously family that has a kind way to put things, but having their input of how do you feel like Fluffy has changed since the last time you saw him. And sometimes it does help to have an outside perspective. Veterinarians can do that. We typically only see these patients a couple times a year. So, we can give you a pretty big variation, but, if your pet has been going into the vet pretty chronically, don't be afraid to have that conversation. I think sometimes clients just hear their vet say, oh, well, we can try this or we can do this, and they keep going because they keep hearing we can do these things. But you also need to advocate for your pet and say, I don't know that it's fair to keep doing more things, and that's okay. And I promise you, most vets are going to also support that. Our job is to find answers and to fix it, right? So we're going to keep trying. But I think as clients and also as veterinarians, we both have, we both need to advocate for these guys and maybe discuss when it's not something we can do anymore for, or we can do a little bit, but you're going to get a few weeks or a few months. And do you want that? Is the time that we're going to have in those small frames worth it or not? Another thing that I like to tell clients to do is to get 2 jars, like mason jars or something, and get some pennies or pebbles or whatever you want. And at the end of each day, ask the family or yourself, say like, okay, did Fluffy have a good day today or a bad day today? And then we put the pebble in the jar. Don't think about it beyond that. Just do it every day. And then at the end of 2 weeks, look at the jars, and it'll give you a better idea, are we at that place or not?
That's a great way of going about it. I love that, because then it ties in all the family and gets everyone sort of ready and discussing it, which is often the difficulty. I often find it's generally one person in the family who'll be like, oh, I'm just not ready. I'm not ready.
Exactly.
And so having the buy-in and having everybody involved in that decision process, I think is a great way of going about it for all involved. Thank you. Thank you for all that you do for our senior pets, and for all the information that you provided us. It was really such an interesting conversation and such a nice way of looking at things. I'm really, really grateful for your time today, Dr. Amanda.
Oh, thank you. Thank you. Yeah, I could talk about this for hours. So
I know. Well, there's so
I'd love
much
to do it again. But let me know.
Well, I think we've got so many subjects, like we were ticking them off the list, but they're endless. Obviously, with our senior pets living longer and longer, we're seeing them get so many disease processes some of which we can manage, and others that obviously just need supportive care.
Right. Yeah, I do think geriatric care is going to become its own specialty.
Absolutely.
I think we're getting there. So we'll see how it goes. But yeah.
Oh, great. And lots to learn in terms of alternative therapies from you. So thank you. Thank you very much for your time.
Thank you.
Have a great day and look after all your patients today. And thank you for your time.
Of course. Thank you. Have a good day.
Okay. Thank you for joining us on today's episode. I hope you have found our conversation with Dr. Amanda, the senior pet vet, as enlightening as I did. Senior pets hold a special place in our hearts, and with the right care and attention, we can help them age gracefully and comfortably. Remember, the key to a healthy and happy senior pet lies in proactive care, good nutrition, and being mindful of their unique needs as they age. If you've enjoyed this episode, please consider subscribing, leaving us a review, or sharing it with other pet lovers who could benefit from this information. You can also follow us on social media for more tips and updates. And don't forget to check out Dr. Amanda's work for more resources on caring for senior pets. Until next time, this is Dr. Carra, reminding you to cherish every moment with your beloved companions. Take care, and as always, don't forget to give your pets a big hug from me. Welcome back to Just for Pets. You're with Dr. Carra.
Hello, Doctor. It's Chanel the Persian. And, I can't seem to stop retching to get this hairball up.
Are you on a special diet?
Excuse me?
Hairball control food will really help. And maybe some Laxapet. And lucky for you, Just for Pets have a big range.
Well, how early can I get some?
Order today, and we'll deliver pronto.
Wow! I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.